ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.
Opioid misuse is a crisis in North Carolina. Leaders in one county are working to help a particular group with recovery from this substance use disorder. This is ncIMPACT. I'm Anita Brown-Graham. The opioid epidemic is a public health crisis that has affected every community in North Carolina. Opioid abuses by those who are pregnant pose special concerns. In Cabarrus County, a group of changemakers have come up with some innovative ways to respond. ncIMPACT's David Hurst looks at this program that creates a network of resources to help women on the road to recovery.
Galana Gillette has dreamed her whole life of becoming a mother. She's now pregnant with her 8th child, but what happened during her first pregnancy put that dream at risk.
It happened really more or less whenever I got pregnant with my first set of twins. I was sent home, of course, with a nice bottle of hydrocodone, and I had my first C-section. So after that was whenever I actually started using, or I should say abusing, opiates, and then after that it just slowly grew to where anything you can name I've tried. My grandmother was diagnosed with cancer. She's more like my mother. She's the one that raised me. And then my dad was murdered in Charlotte. He was a string of murders that happened. He was just washing his car, so it wasn't like he was a good man. He wasn't doing anything wrong. Once he got murdered, I had just told him that I was having a boy and a girl, and I didn't even get to tell them their names. So, of course, it took its toll. I was already getting out of a really bad divorce. So, and then also going through a custody battle with my oldest son at that time. So, between everything, like I said, when they sent me home with that bottle, I just didn't want to feel anymore.
All of Gillette's children are healthy, but she lost custody as a result of her substance use disorder.
After going through what I have now, of knowing that they're not at home and still fighting addiction, I don't like putting it into words because I don't want somebody to think that I don't care about my babies, or I've lived all my life, it feels like, to be a mother and to do for them regardless of how hard it got. And I've not always had their dad there 24/7. So to know that, like I said, I thought that's all I've known is being a mom, and looking in their rooms now and seeing they're not there, and this is all because of a choice that I made to do drugs, or to do a drug, regardless, even if it's 1 or 10, it doesn't matter. But they're my life, and I want my life back.
Galana Gillette participates in the SUN Project, a program run here by the Cabarrus Health Alliance. It provides a network of resources to pregnant women struggling with substance abuse disorders.
The whole thrust of the SUN Project, once it got underway, was to get the care going during the pregnancy so that we could help avoid delivering a preterm sick baby that was only going to exacerbate any hope or attempt on the part of a caregiving team to put the mother on a recovery pathway.
The program creates a network connecting mothers to doctors, social services, hospitals, and other healthcare providers.
Most doctors traditionally would say, I will do the medicine, and then I'm going to refer out for all the other stuff. That was kind of the old way of doing things. Dr. Suda really kind of is a pioneer in saying, the old way's not working. I would like to be at the center of providing care for her, working collaboratively, knowing that I need your expertise in other areas to provide the best care for her.
The rate of pregnant women misusing opioids across the country has quadrupled since 1999. Untreated opioid use disorder during pregnancy can have devastating consequences for the unborn baby. The Sun Project helps patients get connected to medication-assisted treatment. It helps prevent withdrawal during pregnancy and minimizes the unborn baby's exposure to dangerous substances.
Women that are struggling with opioid use disorder, I mean, remember, it's an illness. And women that are struggling with this feel tremendous guilt and shame, and they need someone to reach a hand out and say, there's hope, we have treatment. Actually, there's great possibility for recovery for both you and your baby, and so we need you to come into treatment.
It's nice to know that in the community, the word is getting out that you can come here and you're not going to get shamed, you're not going to get turned away, you're not going to be told that there's 25 hoops that you need to jump through before someone will actually see you. And then you also get a physician who actually says, I'm really proud of you. Thank you for coming. This makes you a great mom. And I don't think they were hearing that before.
It's been about a year since Galana Gillette started the Sun Project, and she now has new dreams to continue on the path of recovery and to bring her children back home.
I feel like if anything now, especially after being the past year, I've tried very hard with my sobriety. You're not going to make the change unless you want it. To know that I can do this and that they're worth doing it for. And they deserve it.
Dr. Andre Jones, Executive Director of the UNC Horizon Program, thank you for being with me. We hear a lot about the opioid crisis, but this is just a slice of it. How big a slice is it?
So in terms of the women that we see every year, each year the proportion of women that have a primary diagnosis of opioid use disorder has been going up. So in the last 5 years, it's gone up from 60 to now 70% of our women.
And what is the risk? What's the threat of a pregnant woman using opioids?
Yeah, so if a pregnant woman has not been treated for her opioid use disorder, the threat can be life-threatening for herself and her fetus. There's a risk of overdose and overdose death for her. And certainly for pregnancy, it's the loss of early spontaneous abortion or miscarriage, preterm delivery, and then if the baby is delivered preterm, it can be born at low birth weight and early, and then there's a risk of long-term NICU stays for them.
What kind of advice would you offer?
Yeah, I mean, I think it's looking for who in their community provides compassionate prenatal care. It's looking for knitting together the different types of social services that are there. So women come with food needs, they come with transportation needs, they come with spiritual needs, they come with needs for childcare. So thinking about all of those different barriers to treatment and looking for unique ways to address them can be very empowering for communities. And many times communities say, oh, I just don't have enough. When in fact, if we actually have those conversations in groups where we break those silos, we realize, wow, we actually do have a lot. You know, we have a child care that's willing to take a child. We have an OBGYN that we never knew existed that can be a champion and a supporter.
Love it. So this is a heavy subject. Talk to us a little bit about the successes.
Yeah. The successes, when we have them, are amazing. And I think that's one of the things that we can do to help overcome stigma and discrimination against pregnant women who are using drugs, is to focus on those successes, because there are thousands of them that we have. When women come in, they often come in with their head down, feeling a lifetime of shame, stigma, and discrimination. And by empowering them, helping them find their voice and use their voice, they're amazing, truly transformational changes. So many of our children come in and they're not meeting their developmental milestones. 9 months after being with us in a structured environment, using our 5-star licensed daycare, having our maternal child therapist, they are not only at par, they're sometimes above par for their developmental milestones. And then our women are getting jobs. They're finding what it's like to have a relationship with yourself, with your child, with other people, and being an advocate in their community.
You can just feel the love when you look at these pictures.
3 years ago, Debbie Dalton received a phone call that changed her life.
My phone rang, and it said Hunter. So I grabbed the phone and said, I was just thinking about you, and I heard this is Blake on the other end. And I knew immediately it was bad news.
Her son Hunter was 23 at the time and had recently graduated from UNC Charlotte. He was living in Raleigh, and his roommate told Hunter's mom that Hunter had been rushed to the hospital because of a drug overdose.
I just remember making a sound that didn't even sound human, and my husband had to take the phone. You know, we're trying to figure out what's happened, and rushing to Raleigh to get to our son, just to get to my boy, and the whole way there just overdosed on what? You know, that just wasn't Hunter's MO.
Toxicology reports later revealed Hunter overdosed on cocaine laced with fentanyl, a dangerous synthetic opioid that is lethal even in tiny doses.
I held my son's hand for 7 days in that hospital, and he never regained consciousness. And I held his hand as he took his last breath. And just shock and heartbreak. He played soccer.
The Cornelius mother says she not only lost her only child, but also lost her best friend.
He definitely had a gift. He was very loved, and he loved back in return. And he was full of energy. Loved to travel, loved adventure. He was my partner in crime and adventure. You know, we just, he lived every second. I can honestly say that.
Less than 20 miles from where Debbie and her husband live, Cabarrus County EMS started seeing an increase of opioid-related overdoses in the months following Hunter's death. The summer of 2017 was out of the ordinary as first responders saw a significant increase of overdose calls.
These types of calls are things we've dealt with on a regular basis. However, the volume was the problem, and we were beginning to see the impact in the community amongst families and just regular citizens as well.
The summer climaxed with 81 overdoses in August of that year, the highest number in the state. At the end of 2017, Cabarrus County EMS had responded to over 550 opioid overdose calls compared to 163 in 2016.
And so I think that we were all very surprised to find out that this was occurring in parking lots in our local shopping centers, and even parking spaces in a downtown setting. And I think that's when we really became aware of how prevalent the problem was.
Cabarrus County has since been able to reduce their overdose rate. County leaders say they've been able to do this through raising awareness about the issue, as well as implementing countywide programs intended to reduce overdoses.
And the first step that we realized is that we needed to start conversations in the community to try to reduce some of the stigma, to just acknowledge that there was a problem and that we needed the community's help.
County leaders hosted several community conversations where discussions centered around local trends and data, dangers of opioid misuse, and information about prevention strategies.
Now many people in Cabarrus County, much like myself, would be much better equipped to see the signs or perhaps raise some concerns when we see somebody that's being affected by this problem. Whereas before, I think it may have gone unnoticed much longer.
Cabarrus County EMS, along with Concord Police and Fire, carry naloxone, a medication designed to reverse the effects of an opioid overdose. This county GIS map shows hotspots where first responders have used naloxone to revive someone.
When we're talking about people's lives, the struggles that they are going through currently because of addiction or because of a loved one's addiction, it's so important when you see numbers or how many times EMS has administered naloxone that you truly think about what is behind that number. EMS administers naloxone X amount of times, that's X amount of times that someone's had a chance at life again. That's X amount of times that somebody's able to see their family member again. When you start looking at it that way, it's hard not to act and it's hard not to find solutions in your community. And this cabinet has a variety of resources.
Cabarrus Health Alliance also began a syringe exchange program. The No Questions Asked initiative allows people to turn in used or dirty needles in exchange for unused clean needles. The program has led to a lower hepatitis C and HIV rate across the county.
We understand that not everyone is ready for treatment, Not everyone is ready to be in recovery, but what we can do until they are ready to make that decision is make sure that they have the resources that they need to be safer and healthier.
While programs and awareness have helped save some lives, first responders say the opioid issue is still a battle they fight every day.
When you hear the personal stories, it really connects to purpose what we do. You can look at data all day long, but it doesn't tell you anything about a human being, just to be honest with you, on that individual level. So connecting with those folks definitely provides me more motivation to understand that what we're doing is making a difference, even if at times it means small and incremental, that we are helping.
Every single year.
Hunter Dalton is one of those personal stories. After Debbie Dalton spoke at one of Cabarrus County's community conversations, she's since started the HD Life Foundation and makes it her mission to educate and warn about the dangers of opioids and other drugs.
We are and will always be heartbroken. We'll never be the same. We're a family that just is gutted. I don't know how else to say it. And my initial reaction was to just curl up in a ball and stay there. But Hunter pushed me, and the way that he lived his life pushed me, and I, as a mom, I don't want any other mom to get the phone call that I got. I would give everything I own to go back and save my son. But I can't do that. But if we can save other people, that's what he would want.
I'm joined by Dr. Anu Patel. Let's back up for a second. When you hear the words opioid crisis, what does that bring to mind?
Well, unfortunately, it brings something that's not very positive to mind. Unfortunately, we're in a situation where we're looking at people who have lost their lives over this issue. In fact, in our state, since 1999, there have been 13,000 unintentional opioid-related overdoses within North Carolina itself. This is not just an issue here in North Carolina, it's a nationwide issue. It affects our neighbors, it affects our communities. There's not only a financial toll to this, but there is a devastating human toll.
Which is why we refer to it as a crisis.
Correct.
How did we get here?
So there are many things that brought us to where we are today. Some of it has to do with the way that we were prescribing medications. Some of that has to do with the education or lack of that we received in our training on opioids, the marketing by pharmaceutical companies that these medications did not have the potential for addiction. And then I think that just the nature of physicians wanting to do the right thing for their patients. So when a patient comes to see you and they're suffering and they're in pain, you want to do the right thing and help them and help alleviate their pain.
What stops people from reaching out and getting the help that they need?
Sure. So I think one of the biggest barriers is the stigma that's associated. I think people who feel that they may be judged or scrutinized may be fearful to come forward and admit that they have a problem or try to seek help for that problem. I think in general people don't realize that opioid use disorder or substance use disorder is a medical illness, just like any other medical illness, and people are unaware that that's the case.
At the community level, what advice would you give leaders who are trying to combat this crisis?
So sometimes what we need to do is sort of think outside the boundaries of our institutions and outside the boundaries of our individual roles in the community, and develop relationships with others that may be collaborative so that we can work on pathways together and work on the resources that we have together as a community. I think there's strength in numbers.
The North Carolina Pregnancy and Opioid Exposure Project is a one-stop online portal where you can find resources, more information, and technical assistance on pregnancy and opioid exposure. The More Powerful NC campaign also raises awareness about the devastating impact of the opioid crisis in our state. Learn more about how your community can get involved by visiting unctv.org/ncIMPACT. Next time on ncIMPACT, North Carolina is home to immigrants from all over the world, but some feel disconnected from their new communities. Watch ncIMPACT to see how one community is actively helping new neighbors become more engaged residents.
ncIMPACT is made possible by funding from Civic Federal Credit Union and is a public media North Carolina production in association with the University of North Carolina School of Government.